Today we're going to be talking about what to expect in the first 3 hours after a cesarean section delivery. Thanks for joining us. For anyone who doesn't know me, I have been a registered nurse since 2009. I've spent my entire career working in the maternal newborn nursing area, including mother-baby postpartum, NICU, antepartum, and labor and delivery. I have practiced as an IBCLC since 2012 and have been maternal newborn nursing certified since 2013. I have also received specialized training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Having a baby is exciting, but a lot of mothers have no idea what to expect after their cesarean section delivery. This video will explore the first 3 hours after your baby is born and let you know the top 10 things you can expect. This is a guide, and the timeline may change for your birth because every birth and recovery are as unique as every mother and baby. Additionally, each facility may have their own policies and procedures following a cesarean delivery as far as when and where you can see your partner and baby. So consider this a general guide of what to expect. Let's start with the first 30 minutes. After what has probably been many months of anticipation, your baby is born. Usually your provider will loudly announce the sex of your baby and hold the baby up above the surgical drape for you and your partner to see. Many providers may practice delayed cord clamping at this time. Delayed cord clamping is when the cord is cut 1 to 3 minutes after birth. It has been shown to improve the health outcomes of newborns. When the delay is complete, the cord is cut and your baby is handed off to a team of providers that will be taking care of your baby. The team is usually made up from personnel of the nursery or neonatal intensive care unit, also called NICU. The baby will then be placed in a pre-warmed bed specially designed to take care of your baby in an emergency called a radiant warmer. Your baby will be dried and stimulated. Now, your baby may or may not begin to cry, so don't be alarmed if you don't hear anything. Many babies are quiet and alert after birth. The team will begin their assessment of the baby, which will include performing the APGAR scoring. APGAR stands for appearance, which is skin color, pulse, which is heart rate, grimace, which are reflexes, activity, which is muscle tone, and respiration, which is breathing rate and effort. A baby can get a 0, 1, or 2 in each category, and these scores are added up to give the score. The highest score a baby can get is 10, although most babies do not get this score. The APGAR is measured at 1 minute and 5 minutes of life. During the baby's assessment, the nurses will measure your baby and get your baby's weight. Often they will let your partner take pictures of your baby on the scale with this measurement. The cord is usually left long, and your partner will often be given the chance to cut the cord, and then a cord clamp will be applied. Your baby may have its first diaper put on at this time, and bracelets are applied to your baby. Most facilities will issue an ID bracelet and give you and your partner a matching bracelet. This tells everyone that this baby belongs to you. It is essential that both you and your partner never remove these bracelets until your baby goes home. The facility may also put a baby alarm bracelet on your baby to ensure the baby is not removed from secure areas of the hospital. Finally, the baby's footprints are usually taken at this time. Many facilities will even make a copy for you to keep. After all this is complete, the baby will often be brought over to you. Depending on the facility, they may allow the baby to be placed skin to skin for a few minutes if you desire it. This helps your baby transition from the womb to the outside world. Others will let you see your baby and take pictures of you, the baby, and your partner together in the operating room. After a few minutes, the baby will be taken to your recovery room with your partner while the surgical team finishes your procedure. While the staff is looking after your baby, there's a lot going on with you. Your provider will deliver your placenta. Once this occurs, the anesthesiologist will start to administer Pitocin in your IV. Pitocin helps your uterus to contract down and reduce your bleeding. The provider will then examine your uterus and other pelvic organs to ensure everything looks good before beginning to stitch you up. The stitches that are being used on the inside dissolve and will not need to be removed later. If you feel nauseous, the anesthesiologist will give you some medication through your IV to help you with this. Then the incision will be closed on the outside. Your provider may use dissolving stitches, a medical-grade adhesive or glue, staples, or a combination of these materials to close your incision. The incision will usually be covered with a pressure dressing, which is a bulky cotton pad secured tightly with a lot of tape. This provides pressure on the incision to prevent bleeding from the incision site. Your provider will remove the surgical drape and perform the first fundal massage. This is a deep massage at the top of the uterus that helps remove clots and decreases bleeding by assisting the uterus to contract back down. This can be uncomfortable after a cesarean section, but luckily right now your anesthesia is still working well and all you will feel is pressure. The rest of the surgical team will now clean you up and get you ready for the recovery room. Your thighs and vagina will be washed and a new pad will be placed underneath you. You will be given a new gown and fresh linen. The team will usually then move you off the surgical table and into a bed. Then you're off to the recovery room to see your baby. Now let's talk about 30 minutes to 1 hour after birth. Recovery rooms vary in size and layout, but most are a big room with smaller areas divided by curtains for patients. Once you're brought into your designated area, the staff will perform a bedside handoff. Usually your anesthesiologist will let the nurses know what medications were given during your surgery, as well as your vital signs and overall condition throughout the procedure. If the operating room nurse will not be your recovery nurse, then that nurse will report off to your recovery nurse, including your health history, allergies, and pertinent details of the procedure, like blood loss and the type of closure you have for your incision. While this reporting is taking place, your caregivers will be hooking you up to a variety of monitors. You will have a blood pressure cuff and an oxygen monitor put on so that your vital signs can be measured in preset intervals automatically. Additionally, you will be placed on a heart monitor to check your heart rhythm during the recovery period. You will still have your IV and will continue to receive fluids and medications, including the Pitocin mentioned before. Depending on your oxygen readings, your providers may want you to receive oxygen. This is usually done through a nasal cannula, which is a lightweight tube which splits on one end with 2 prongs that are placed in your nostrils. Now, let's talk about 1 to 2 hours after delivery. Your partner and baby have probably been waiting in the recovery area for you. Once you are set up, your baby will be returned safely to your arms for skin to skin. Skin to skin helps to regulate your baby's temperature, heart rate, and breathing. It also helps with breastfeeding if that's your plan. Ask your provider to lower the lights and stay in a reclined position. This is more comfortable for you to recover in and more natural for your baby to transition in. Newborn mammals have a series of pressure points on the chest and abdomen that trigger feeding behaviors when laid on their tummy on the chest of their mother. Having the lights low is better for your baby who has been living in a dark, warm environment and is now bombarded with bright light, which can be overwhelming. This is a time for both you and your partner to stay off your phones. You are excited and want to share the happy news with family and friends. However, this can happen at any time, but you will never get back these first moments with your baby. Talk with each other and talk to your baby. Take pictures of mom and baby together. And remember, no using the flash. Cherish this moment. This is the start of the bonding process. While you're enjoying your first alone time with your baby, your healthcare provider is caring for you and monitoring you after major surgery. This is not a time for visitors. Birth is a messy process with lots of blood. There are lots of instruments and equipment around. Many recovery rooms are too small to have a lot of people inside. Between skin-to-skin, breastfeeding, and bleeding checks, which occur every 15 minutes or so, your body will be constantly exposed for brief periods of time, which can be awkward in front of visitors. Additionally, in most facilities, it's not safe to ask visitors to step in and out of the room for these types of things. During this time, the providers will need to measure vital signs on both mom and baby, which requires a calm, quiet room for accurate measurement. All of this makes visitors impractical and intrusive in a recovery room. Remember, this is a time for bonding, resting, and regaining strength. Visitors often mean well, but can interrupt the natural form of recovery. Too often they want to hold the baby or touch the baby, which can interfere with the natural process of breastfeeding. They are concerned the baby is too cold. They may rush mom to eat or drink when she isn't ready. Or they have opinions on what position she should recover in. This can create an atmosphere of chaos instead of serenity. Keep these first precious moments close and cherish them with your partner and your baby. Believe me, in a couple hours, visitors will be more appreciated and even more helpful instead of a possible interference. Whether your surgery was planned or not, you probably haven't had anything to eat or drink in a while. In the recovery room, you will probably not be offered anything for the first hour because the nurse is making sure you are stable and feeling well. Once that has been assured, the nurse will probably offer you a small amount of ice chips. Anesthesia can sneak up on you. 1 minute you feel great, and the next minute you're vomiting. So go slow. Savor each ice chip and listen to your body to make sure you're not getting nauseous. The worst thing is to vomit after abdominal surgery. Finally, you're probably going to feel exhausted. Sleep often comes whether you want it to or not. Close your eyes and rest while feeding your baby. You should never sleep with your baby, but often in these first 3 hours, fatigue will come in waves. This is a time for your partner to keep watch and make sure you and your baby are safe. If you are truly unable to stay awake and your baby will not be breastfeeding anymore, your partner could practice skin to skin in your place. Now on to hours 2 to 3. Now you are in the home stretch. Recovery time is usually around 3 hours before transferring to postpartum. The provider taking care of your baby will usually come to take one final check of the baby, including a set of vital signs. This is to ensure your baby is transitioning well and remains in good health. Additionally, this is the time for medications to be given to your baby. Erythromycin ointment is given to prevent eye infections from bacteria within the uterus. It should be delayed until after breastfeeding has happened, as it will make the baby's vision blurry. You may notice it is goopy and runny. That's okay. It will absorb over time. You will also be offered 2 shots for the baby, the vitamin K shot, which is a medication, not a vaccine, and the hepatitis B vaccine. Once the healthcare provider is done with your baby will usually be wrapped in some warm blankets. Now is the time for your partner to hold the baby. This is often the first time for some one-on-one bonding between partner and baby. Partners, make sure to talk with the baby and hold the baby close to your face. Newborns can generally see things clearly 8 to 12 inches away from them. Being able to see you clearly can start the bonding process between you and the baby. Most importantly, remember to take a picture of this special moment. Your recovery is almost complete. While your partner and baby are bonding, the provider will turn their attention to you. Your nurse will get one last set of vital signs to make sure you are stable. The nurse will also check your urinary catheter at this time to make sure you've put out enough urine and will empty it. A urinary catheter is a small, soft tube inserted into your urethra during the cesarean section to empty your bladder. You are given this for 2 reasons. First, the anesthesia will put to sleep the nerves that cause the sensation for you to urinate. If your bladder gets too full, your bleeding will be worse, so it is essential that your bladder stay empty. But if you can't feel the need to urinate, you need a catheter to do this for you. The sensation will come back anywhere from 2 to 12 hours after birth. Additionally, most hospitals will have you on bed rest anywhere from 8 to 18 hours after birth. This means you can't get up to go to the bathroom, leading to the need for a urinary catheter. Now, back to your recovery room. A final fundal check will be done to ensure bleeding is stable. Then the nurse will get you cleaned up again. Your vagina will be cleaned and the pad beneath you will be changed. You will usually be offered a new gown and linen if needed. All those wires and monitors that have been attached to you will be removed except for your IV. Congratulations! Your recovery is complete and it's time to transfer. Your provider will probably notify your next caregiver about how your surgery and recovery went. Then they will transfer you to the next room in the bed. Partners should make sure all your belongings are together so that nothing gets left behind. Once everybody is ready to go, ask your provider for one final picture of the three of you. This way, you have a way to remember this special moment. This video has examined the top 10 things to expect when recovering from a cesarean section delivery. We hope it has helped explain what to expect after your delivery and helped you understand why certain things are happening in your operating room and recovery room. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.